Do you or someone you know have too much curve through your mid-back? Head going forward, postural concerns? A thoracic hyperkyphosis, or too much curve in the mid-back, can cause a lot of different problems. One, it can cause those shoulders to round forward. It can cause the head to come forward, which can cause headaches, neck tension that just never seems to go away. Now, what are some things that you can do to actually correct that? Postural exercises such as thoracic extension and mobility exercises can be very useful, but that's only if it's a postural issue. There might be something going on in the structure inside, and if that is the case, what we need to do is a more specialized approach, such as traction. Spinal traction, having your back into an extended position for up to 15 minutes at one time, is going to cause those ligaments to lengthen more permanently, and that's where we're going to get more long-term change. What are some risks associated with too much curve in your mid-back or thoracic hyperkyphosis? Well, one of the most obvious is going to be those postural concerns. You're going to see those shoulders round forward, the mid-back becomes super rounded, and that head getting shot forward. However, there are some things that you don't necessarily see on the inside that can occur with too much curve in your mid-back. We've got two very vital organs in our chest cavity. That can be our heart and our lungs. And what can happen as we have too much curve through that mid-back is the cavity for our heart and lungs becomes smaller, which means that those lungs cannot inflate as easily or as well, and that heart has to pump even harder. If the heart has to pump too hard, that can lead to high blood pressure. High blood pressure is known as the silent killer because you cannot see high blood pressure until it gets you. Too much curve in that mid-back can start to cause excessive load through the front of those bones, and that can cause what's called a compression fracture. And a compression fracture can cause pain, but it can also cause more of a permanent deformity in that mid-back. We absolutely want to prevent that from getting to that point. So if you or a loved one or someone else that you know has a postural deformity, too much curve in their mid-back, forward head posture, we would love to get you evaluated here at Square One Health to see exactly what's going on. An evaluation will probably look like an intake to see exactly how this is affecting your life. We might even take some x-rays, and those x-rays are going to be able to show us whether this is truly postural or if this is something more structural. Come into Square One Health today, and we'd love to be able to get you in for a more thorough evaluation so we can see exactly what's going on and give you the best possible course of treatment.